All right, welcome everybody. I'm glad you could show up on this busy Monday. I know we don't like to always come in on those Mondays, but I'm glad to see you here. Of course, we're going to talk about making space for enhancing cultural humility for the LGBT patients. So who's speaking? This is me and my husband. We just went on a trip to Ireland, Scotland, and Iceland. It was fantastic. I recommend Iceland as a bucket list for most people. But I own a consulting company on the side, so I do work clinically 4 days a week. And I was a past president for the Nebraska Dental Hygienists Association, so that's where I'm from, is Nebraska. For some people who don't know their geography, that's the centerest most state in the United States. But with my consulting, coaching, speaking, I try to elevate dental hygiene growth within the practice, sometimes through production, sometimes it can be through confidence. And then I have my master's in business management, and my personal mission statement is to be a creative force through humor and understanding to change people's lives. So hopefully we'll get to do a little bit of that today. My past is I'm a small town kid in a population of 308. So there was only 10 in my graduating class. I know some of your jaws are probably dropping right now. So it was a little tough growing up as a gay kid because there was a lot of denial happening. I was also raised by my grandparents, which probably didn't help out matters because they were very 1950s family, where it's the spare the rod, spoil the child type people, very religious as well. And then I was actually forced out of the closet when I was 21. And we don't necessarily have to get into that long discussion because, again, we only have an hour. So, and as of right now, I've been married to my husband this last January for 10 years. And then these are our two little kids, Raya and Armani. They're both pit bull mixes, and I love them dearly. Okay, so what we plan on learning today is we're going to recognize maybe some of our unconscious biases and then increase our emotional intelligence by doing so. We're also going to maybe identify some familiar terms used by the LGBT plus community. Now, you'll see throughout my presentation, I may say queer community, I may say LGBT plus or LGBTQ or LGBTQIA2 plus, which is the full acronyms. All of those are correct and fine, just as long as you add the plus symbol at the end, showing that there's more people involved that you may not have listed. And then we develop different strategies for at-risk individuals, which the queer community is considered an at-risk community. We'll recognize effects in the mouth for queer people, and then we'll modify strategies maybe to enhance the cultural humility within your own office if you see change needs to occur. So cultural competence versus cultural humility. You'll notice that I was using the word cultural humility and not just cultural competence. There's been a little bit of a shift in the health industry or healthcare industry, I should say, as far as which word to use. And they're starting to shift more towards cultural humility. Cultural competence, of course, as you can read there, is an appreciation of people's culture and belief systems. However, when you're competent, that means that you're good to go, you have the ability, the knowledge, and the skill, and you're successful. The only problem with that is that culture is constantly changing, and so it's hard to depict if someone can be truly competent within a culture. And it kind of has a top-down mentality where someone decides, like myself, if you're competent within that culture. But again, it's like, who am I to tell you if you are competent? You might be more intelligent in this topic than I am. So that's why we try to lean more towards cultural humility, where it's more of a process of continual learning. So you respect and you inquire and show empathy towards different people's culture. And therefore you do self-reflection. And the best part is that it's more in line with the core of holistic care because you're caring about the individual or the wholeness of the individual itself. So one of the things that we always need to recognize is bias. We all have bias, and that's totally okay. Because that's where our personal preferences lie. Whether a main example that I use is Colgate versus Crest. You could argue that one is better than the other, but at the same time, they're both great products. And so therefore you'll have a personal preference towards one or the other. The other thing is that you could always go with Oral-B or Philips Sonicare. And just as a side note, I want to thank Philips Sonicare for sponsoring tonight's event. So just FYI, I kind of forgot to mention that. Sorry, Philips, I love you. But anyway, so biases happen all the time. Now, when we talk about implicit bias or unconscious bias, that is when you're unaware that you may have a bias towards a certain person, group of people. So an example would be stereotypes, where they come from, or gays are great at decorating. You're not meaning it to be mean. You just may have some friends that are good, that are gay, that are great at decorating, like Nate and Jeremiah over here that you see on HGTV. Your bias may not be wrong, but it doesn't necessarily mean that that's always true for everybody. And then explicit bias is when you're completely aware of your prejudice. The reason why I had this other picture is because this new labeling of Karens has kind of come out. And so the reason why they got that label is because of explicit bias, where they're aware of their prejudice and attitudes towards certain groups, and they just don't care. They're going to tell you how they think. And if it's discrimination, they could care less. And so examples of explicit bias would be like, well, transgenders are going to molest my children in the restroom, or me, type thing. Another one would be all gays have HIV, or lesbians are all butch, type thing. So you start to show discrimination when you express it verbally, or you show discontent towards that group, and categorize people, things into a certain idea that's not necessarily true. Megan Fucciarelli, again, I only have an hour, but here's a link to her TED Talk. And she kind of talks about bias. And she says it's simple fact and human nature to have bias. It's only harmful if you allow it to change the way you treat people or speak to people. Then that's when your implicit bias becomes explicit and discriminatory. So that's just something to think about as you're going through this. If you start to have maybe some negative thoughts or feelings, then you can kind of see if it's more of a bias or if it's something that is a personal belief, which is fine too. Not discriminating, but personal beliefs, just to be clear. Okay, so I kind of wanted to do a little bit of history of LGBT because it's kind of important to know where we came from in the United States, what we've had to face, and what's kind of been going on. So one of the things was between the 1920s and 1950s, we had Henry Gerber. He was a German immigrant from Chicago. He started the first club of Society for Human Rights, but it was considered illegal for too many gays to congregate together. So there was lots of raids, and it broke up within a year. But he also was the first one to publish a gay newsletter called Friendship and Freedom, which seems pretty harmless. But back then, I guess it was big taboo. And 90 years later, the U.S. government made his house a national treasure, which was kind of awesome. So that's the Henry Gerber off to the right there. Then you can see the pink triangles. They were used to identify homosexuals in concentration camps. So that's why now a lot of the pink triangles on flags, we've kind of taken that identity back. And so that's kind of where that came from. But basically between 5,000 to 15,000 people, 65% of those were killed between 1933 and 1945. And even after World War II, East and West Germany still upheld an 1871 anti-gay law, where they still incarcerated all of those people that were in concentration camps until early of 1970s. So it wasn't bad enough that they had to go through the concentration camps and that, more than half were killed, but then they threw them in jail until 1970, 30 years later. And then we had 1948, the first scientist, Dr. Kinsey, started to study sexuality and discover sexuality is more on a gray scale. So this determined that when he was talking and interviewing and figuring things out with all of these other male individuals, he found that there wasn't such a thing as just straight and just gay, but a blend of people being between 1 and 10, 1 being the most straight and 10 being the most gay on people's attraction levels. And so this book was published, Sexual Behaviors in the Human Male, a year later. And then he also, a year after that, then published Sexual Behavior in the Human Female. But this was, questions were already being answered by this book back in the day. However, in 1952, the American Psychiatric Association, even with Dr. Kinsey's research, depicted gay as a mental disorder. So then, of course, Eisenhower reacted and signed executive orders to ban gay people from working federal jobs, because obviously you don't want people in the government if they have a mental disorder. So between 1950 and 1980, this one kind of makes me laugh or grin a little bit, because Batwoman was actually created to squelch rumors of Batman and Robin being a gay couple. So it wasn't for women's lib or women's rights or yay, women power, but more that we had to keep Batman and Robin separate by putting a woman in there. And then we have 1961, Illinois, woohoo, was the first state to get rid of anti-sodomy laws discriminating against gay people. Also in 1965, we had Dr. John Olivins, who published a book and used the word transgender. So that was the first time that that word was ever used within our society. Then in 1966, you can see the picture across over there. They did a sit-in in New York to protest disorderly conduct. What that meant was it was illegal to serve alcohol to queer people. And then if they did decide to serve them alcohol, they had to turn away from people like a naughty kid being turned into the corner, because if they were to socialize with anybody, it was considered disorderly conduct while they were drinking. So like the sit-in with the Human Rights Organization down in the South, the gay organizations decided to do the sip-in and protest disorderly conduct in New York. Then you had in 1969, the Stonewall Inn riots, which is protesting raids from cops. That lasted for about 5 days. The first raid, they came in and the transgender community, believe it or not, was the strong ones in this, and they had just had it of being treated in such a strong discriminatory way that they decided to fight back. And so a lot of more LGBT people joined in, and the police actually had to run into the Stonewall Inn to hide from the LGBT community, because there was more LGBT people than there were police. Then in 1970, they decided to do a march for protesting, and that actually turned into then what they call the first Gay Pride Parade. So in 1973, homosexuality, they finally changed it to no longer being a psychiatric disorder. In 1978, Harvey Milk was the first openly gay man to be elected into a political office in California. And the reason why there's those the gay pride flags down below is because Harvey Milk's campaign created the first gay pride flag. But he was also killed in his term in office, assassinated. Then we have the 1980s, where the outbreak of AIDS and that pandemic hit, and you had 1984, where Ryan White became infected. And Ryan White was a kid with hemophilia who had to take in blood, and then that's where we have the big blood donation issue and with AIDS infection. And then we have the history of LGBT from 1990 till now. And 1992, we had the Don't Ask, Don't Tell, where about 12,000 officers had been discharged because of their sexuality. I mean, personally, if someone wants to put their life on the line, I wouldn't care what their sexuality is. But in 1994, Matthew Shepard Act was created for anti-hate crime laws, which basically imposed harsher sentences for victims of sexual orientation, because Matthew Shepard was that one individual in Wyoming where they were pistol whipped, tortured, tied to a fence, and left to die. Then we had in 2003, the Supreme Court strikes down all anti-sodomy laws, so no longer criminalizing homosexuals nationwide, which is crazy to me because I was in college then and I didn't know that basically I was breaking the law. And then we have 2011, where Obama repealed Don't Ask, Don't Tell, so allowing queer people to openly serve in the military. Then in 2013, transgenders were no longer a psychiatric identity disorder. So that was taken away. And in 2015, gay marriage was actually ruled legal by the Supreme Court. So that made it legal for gay people to get married. And then we have 2016, 2017, and 2020. The reason why that constantly shifts is because it was allowed for transgender people to serve openly in the military in 2016. Then it got changed with the presidency in 2017, and then it was reenacted in 2020. So it is okay for transgender people to serve openly in the military. So history, why is this important? Why am I going over this? Well, it's important because the more we are aware of why they act the way they do, the easier it is to understand them and help them in the situation. So you might then understand why they're maybe not being truthful, because understanding minority stressors and the stigma of discrimination can contribute to a negative health behavior and outcomes. Minority and stressors involve traumatic and chronic experiences, which a lot of people, even nowadays, can still experience within the healthcare vicinity as well as in publicly. But some of it is just family rejection, bullying, harassment, concealing of their identity, and partner abuse. Some of that raises cortisol as it causes unhealthy coping behaviors and leads to a range of morbidities. This picture was again in 2016, where the Pulse Club shooting occurred, where there was 49 dead and 53 injured in the LGBTQ community. So not that long ago. So this is the full acronym, LGBTQIA2S. And the term, you have lesbians, gay, bisexual, transgender, queer, questioning, intersex, asexual, or ally, and then two spirits. And yes, I will go over what those mean. But one thing that's kind of interesting is it used to be GLBT, so gay was first, just because it's a male-dominated society. But they changed it because the gay community wanted to respect the lesbian community in the fact that they were there helping them through the AIDS crisis. So a lot of the lesbians were there taking care of them when they were dying and sick. And so it is now, since the 1980s, been LGBT rather than GLBT, putting lesbians first, thanking them for all the work that they did. So before I get into those, I want to explain how each one coincides with a different category, because sometimes it's easier to understand if we can somewhat, I know we don't like to label, but that's what all these are. So we have gender, attraction, and sex. If you think of gender as their identity, so it's the role of either a man or a woman, according to social norms, so feminine, masculine, androgynous, it's how they identify. Attraction is obviously romantic feelings for another, so how they are sexually attracted to that individual. And then sex obviously is the reproductive anatomy assigned at birth, whether they are male, female, or intersexed. And then of course you have all of this combined together, which gives you then the expression, which is how they may look, whether they're more masculine or feminine, and how they present themselves. So with the terminology, most people know the top three. So lesbians obviously are women attracted to women. And I put red, blue, and purple. So red is your attractions, like the heart. Blue would be your gender. So again, the cloud in the sky in your head of how you identify. And then purple is the ally, because it doesn't fit into either. They're just there to support us. But sometimes people will hear gay like, hey, mom and dad, I'm gay, and it could be a woman. Well, gay is sometimes used as an umbrella term to mean that I'm attracted to the same sex, but then it also stands for men being attracted to men. So I would be a gay man And then you would have a lesbian who would be a lesbian woman. So those differentiate each other, but a lesbian could say that she's gay to their parents, expressing that she has feelings for the same sex. Now, bisexual is obviously attracted to men and women, and then pansexual is attraction to a person's qualities regardless of gender identity. So you might look at that and be like, well, then isn't a pansexual technically the same as bisexual? But a bisexual person is only attracted to a man or a woman. So that means they wouldn't be attracted to someone who's transgender or someone who's more gender fluid. They like people that fit the stereotype norm of what a man or a woman looks like. And then a pansexual person is, I don't care what you look like on the outside, I'm attracted to the person on the inside. So pan basically means everyone. So then you have your transgender, which remember blue is identity, which again is gender identity, which is different expression of the gender than what you were assigned to at birth. Queer is an umbrella term for people who think of their sexual orientation or gender identity as outside the social norm. So you've heard me say the queer community, that basically describes this whole terminology. Now, why don't we just call ourselves the queer community? I don't know. I guess everybody wants to have their own individual importance, and so we stick with the different labels. But you could say that this is lectures brought to you by the letter Q. Side joke. And then we have intersexed, which is reproductive organs that don't develop according to traditional expectations. Now, the intersexed individuals were the ones that kind of brought about transgenderism, in the extent that you would have a boy or girl that would be born with both parts. Now, what would usually happen is the parent would then be like, well, it's easier just to turn it into a girl, let's just have the surgery, and then that way they can function in society and be normal, whatever normal is. And what would happen is that this individual would grow up and feel that they were in the wrong body because they felt more like a boy, wanted to do boy stuff, dress like a boy, look like a boy. And so that's when they started to discover that gender necessarily isn't between the legs, but how maybe someone identifies within their own brain or how they feel. And so that's where the intersex part actually came about for transgenderism, is that people weren't necessarily lining up, if you change someone's gender, that then they would react to that gender within society. And then you have asexuals, which are, they have little to no sexual attraction for other people. Now, asexuals can be in relationships. So they like romantic relationships, hugs, loves, being around people, but they just don't want to do the dirty deed. Where your aromantics are just the ones that want to do the dirty deed, but they don't want any romance or relationships. So moving on, because that can sometimes be a little uncomfortable talking about. And then, of course, you have your allies, which are all of you, hopefully, out there supporting us in this community. And then two spirits is an umbrella term used by the indigenous people to describe basically the queer community. And the reason why they do that is because Native Americans will use more of a verb-focused language rather than a noun-focused language. And so they felt that two spirits better identified how they thought about the queer community compared to those that were not. And moving on. Okay. So we now have the gender and how you identify. So cisgender obviously means you identify within the traditional sense. So each one of these pictures is a cisgender, bigender, transgender. So my husband and I are cisgender, means I could basically hide in society except for my voice. If I were just to walk, I'd be fine. And then bigender is where they kind of identify as two genders combined. And so these are my friends. So yes, I have permission to share these photos. They kind of fit the masculine, as you can see, but then their eyes are done up and their clothes are a little more feministic. So again, we have masculine and feminine combined there, which would give you then that bigender identity. And then finally, we have the last one, which is then your transgender, which this person is Elliot Page. She's in the Umbrella Academy, doing a fantastic job, by the way. You should watch it if you haven't. It's a pretty good movie, where obviously they don't identify with the sex that they were assigned with at birth. And sorry, I have like the question answers and it's like in my way and I can't figure out how to get it out, but that's okay. I'll keep going. So if I pause, that's kind of what I'm doing. I'm trying to read around the questions answered. So gender more. So you have trans plus or trans asterisk, I guess, and that's an umbrella term for non-cisgender identities. So you're like, okay, what is going on? So if you think about it, again, transgender individuals, man switching to woman, woman switching to man. But what if there's someone in the middle that doesn't quite feel man, doesn't quite feel woman, but they feel trans, so they're not quite comfortable enough in their body? This is where that trans plus kind of comes in, where it kind of fits that gender non-conforming. I don't necessarily feel completely man, don't feel completely woman. I'm somewhere in the middle. And that's kind of where the gender fluid might come in, because you identify may shift or fluctuate until you really get to know who you are on the inside. This is one of my good friends. He goes by Ryan Spears. And you can see that he's a very attractive man, but then he can also be a very attractive female too, depending on what he wants to portray or where he's performing. And then he kind of has this bigender bit going on with the more feminine jewelry, but yet masculine look to him. Great guy. And so you would consider this probably to be gender non-conforming. So he's expressed gender outside the traditional norms. And then non-binary people, they identify outside of only male or female. Now, Ryan here, when he goes out into public, he dresses as a man. So he considers himself cisgender, but he could be gender non-conforming because he's expressing his gender, not necessarily identifying. So that's kind of the difference. Gender non-conforming is an expression, where your gender fluid, non-binary, is more an identity. So they identify as not fitting within male or female, where he fits in with thinking he's male, but just does performances that are more gender non-conforming. Then we have transgender versus drag queen. And so this basically is an individual. If you see on the one side, this is where they are a transgender individual. And then on the right side is where they're a drag queen. Drag queens are a persona of confidence and more like performance. So it's usually an exaggeration of the feminine qualities and usually done on stage. So you can kind of see that everything's kind of done up. But again, good friend Sophia Kennedy, she's transgender, and so she identifies that way in public. She identifies as female, and so it's not a performance on the left side. That's just who she is. So as we talk about transgender terms, you can have transgender women, trans women, or male to female. Then you have transgender man, trans man, or female to male, which is FTM or MFT. So if you see those on medical histories, that's what those mean. Then you also have non-binary, gender queer, or transmasculine, transfeminine. By misgendering people intentionally, it's kind of a form of disrespect. So you're you want to really make sure that you're validating who they are as an individual. Gender affirming or gender confirmation is preferred sometimes over transitioning, because with transitioning, it's almost like, oh, it's just a phase that they're going through, where gender affirming or gender confirmation is they're finally getting to be where they want to be in life. And so they're affirming their gender, they're confirming their gender, not just going through a transition. And then of course you have the fact that transgender does not imply any specific sexual orientation. Now remember, sexual orientation is whether they're gay, straight, bi, all that jazz. So transgender individuals is their identity, not their attraction. So now we have pronouns, which you come into contact within the healthcare facility, where you have he, him, and she, her, which are your masculine and feminine. And of course, you have Mr., Mrs. Well, the they, them, their for non-binary people, you can use MX if you're sending them an invitation. And then I just listed some examples of pronouns. So you have like Z, here, here's, or am, airs, which are the non-binary pronouns. So an example would be like, he went to pick up the dog. Well, you could say, well, A went to pick up the dog, or Z went to pick up the dog. And then that dog is hers. You would be like, that dog is airs, or that dog is here's. So those are kind of some examples of different things that you can, or that some people may use. And the thing is that you will mess up, but just know that that's okay. Because I was dealing with an individual that was non-binary, so they preferred to use they, them. And she kind of looked more feminine, but was expressing masculine. And so I made the slip up where I'm just like, oh, you want to make sure your teeth aren't yelling at you over here saying that she's not brushing her teeth well enough. And they looked at me and they're like, oh, my pronouns are they, them. And I was like, yeah, I know. I'm so sorry. I was like, I didn't mean to do that. And they're like, no, it's okay. And so, just apologize and move on. You don't have to make it awkward, because the more you focus on it, the more it makes people uncomfortable. So again, it's like a new language. It'll take time to develop and work your way through. So something here is, this kind of shows the percentage of households with same-sex couples from 2008 to present. And you can kind of see that it's on the rise. But the blue area is where you have same-sex unmarried couples, and then the green is more of a same-sex married couples. And you can see that right in the center, it switches. And if we remember in 2015, that's when we legalized marriage between the queer community. So it's kind of cool to see the rise of couples, as well as seeing the rise of marriage, how it kind of follows society's trends. Now we have something else, which is the American self-identification through a Gallup survey that did 2012 through 2017, and it shows how there's an increase in LGBT people. And they kind of predicted that in 2020, it'd be 5.6%. The reason why they think that there's a constant increase is that the more acceptable society has become, the more people are then answering the surveys correctly or becoming more expressive as who they are as individuals. So this current survey that was done by the William Institute showed that it, currently there's 7.1%. So it's a little bit higher than what they thought or predicted for now in 2022. And like I said, there's possibly more. They believe that the queer community makes up about 10% of the United States population. So we're almost there, but not quite. But there's already 1.3 million people that are transgender. The red areas kind of show your worst areas for LGBT laws that protect people. And then your green areas are the best areas to live in for LGBT laws within the United States. So what we want, obviously, is reduction in disease and progression. We want increased mental and physical well-being, as well as access to high-quality care. But what we have is higher rates of HIV-positive status, hepatitis, and other chronic conditions. Higher rates of mental health issues as well, like depression and suicide ideation, are occurring. And then people have also shown that they've experienced judgment, uncomfortable reactions, sometimes refusal of health care, physical and sexual harassment and violence within actual healthcare settings. So I kind of broke this up into different age groups just to kind of show what we got going on within these individuals. And so your youth are 2 times more likely to attempt suicide. And in 2019, Youth Risk Behavior Survey showed that it was 46.8 would actually consider suicide. So about half of your youth would consider suicide if they belong to the LGBT community. And then half of that, so about 25% would actually attempt suicide. With the Trevor Project, it showed with their survey that 45% have considered. 33% of that were cis, meaning individuals, again, that could blend into society, versus 50% for trans. So 50% of people that were trans thought about or considered suicide. So 60% of your youth who wanted mental health care couldn't get access to it. And again, that was the Trevor Project survey of 2022. So that's kind of shocking that 60% within nowadays or today still can't get mental health care. And then, of course, there's the Family Project. And I put that up there, that does research based on education, caregivers, providers. So if you have a family or a family member that accepts one child, their risk of thinking about suicide or attempting suicide drops by 50%. So that's where parents make a huge difference, or even family members within a queer community or a queer child's thought process. And then the LGBT youth continued. So resentment revolves around homophobia, heterosexism, and is not limited to their homes. I had a little bit of homophobia just because I was scared to be around gay people, because I thought that then I would be judged for being gay for being around them. Obviously, I had to work through those issues, and a little bit of heterosexism, where I thought that hetero people were better than me because they were more normal. And then peer victimization. The CDC shows that LGBT people are bullied 33% compared to the 16% that are hetero, meaning straight. It also shows that this could be peer victimization, physical or mental abuse, substance use, family rejection. So with those, they're more likely to use drugs, 23% versus 12% of straight individuals. And then this one kind of shocked me, that that LGBT youth are forced to have sex 22% more so, or 22% versus 5% of the hetero population, which that's kind of saddening. But I guess lack of confidence or not understanding yourself can kind of do that, I guess. And not blaming them by any stretch of the imagination. And then youth find it difficult to share their queer identity. Many look for safe zones. And so I always say you can always get a simple equal rights sticker and put that in your op. That way that they can kind of see it and look for a safe zone where you're not necessarily have to say anything or assume anything, but they can see that maybe it's a safe place. And then we have your gays and lesbians. So lesbian and bisexual women are more likely to be overweight or obese, and lesbian women are less likely to receive preventative cancer screenings, because with most of those screenings, it always puts them in a vulnerable or an uncomfortable position. And it's like, if you don't already feel comfortable in society, you're definitely not wanting to do something like this that makes you feel more vulnerable. And so that's why they're more or less likely to get preventative care. And then and the same could be for dentistry. Gay men are higher risk for HIV and STDs, especially among Black men. When you start to add more minority stressors onto individuals, their risk of health behaviors increases. So they indicated that Black GBQ men are 2 times greater odds at being unemployed, low income, previously incarcerated, or having less education compared to those of the GBQ men. And then the CDC indicated that 83% of new HIV diagnoses have come from males 13 and older. So there's still a little bit of education that needs to be done, sometimes with the gay population, as far as not being scared of HIV anymore, which I'm not saying that they have to be scared of HIV, but just to be a little more conscious probably wouldn't hurt. And then you have a new population that has occurred, which we're not used to seeing within the health disparities, and that's the aging population. Because there's now over people who are 65 or older, they're less likely to identify as LGBT compared to their older or their younger cohorts. But there's already 4 million older Americans who identify as LGBT, and that number they think is just going to double within 2030. Because obviously we know that there's already been an increase. And then that increase in people over 50 who are living with HIV sometimes risk of higher depression and cognitive impairment. They're more likely to live alone because they're less likely to maybe have children. And the LGBTQ community can be a little age bias, where we like society like to look younger and like the younger crowd. This picture is of me and my husband, but ironically enough, the guy in the glasses next to my husband was my dentist when I was younger, and he lived in a small town, had 2 kids and a wife. And so both of us were in the closet. He was who I job shadowed, to get into the dental community or whatnot. And so it was ironic that both of us were gay, but neither one of us were out and knew about each other until later. And so this is us meeting up for the first time to kind of just talk to each other and see how things were going. So that was kind of crazy. And then transgender individuals, we obviously know that they have a higher prevalence of violence, mental health issues, and HIV. They're 45 to 75% more smokers and drinkers, 30% use illegal drugs, 23% don't seek medical help due to fear of mistreatment. 25% are denied coverage from insurance even, and 40% of them have contemplated suicide. And then you can see my little equal sticker down in the corner. So I just have it face towards the individual so they can see right away that I'm for equal care and equal rights of individuals. And then we have, I love this diagram because it kind of then depicts how society can affect people's behavior and physical health. So you have external stressors that start first in the purple diagram, where the individuals figures out if they're homosexual and realize that they're in a sexual minority. Then you have it splits, and so they know that they now have minority stressors where there's homophobia and bullying. They have descriptive norms where they want to be like their friends but realize that they're not, but they try their best to be. And then you have injunctive norms, which is what society expects of you. You want approval from your parents. You try to do your best to fit in. And then all of that can culminate to behavioral health problems where you have substance abuse, promiscuity, if you're not feeling loved, depression and anxiety, obviously, because you're not feeling like you're fitting in. And then that can interpret then into physical health problems like STDs, anorexia, oral health issues, and even suicide. So the social determinants, as we kind of talked about, but just summed up as legal discrimination can be a problem, especially if you don't have any housing, marriage, adoption, or retirement benefits, lack of laws protecting them, social programs, and then also shortages of healthcare providers. So this is kind of for educators. This shows that they surveyed 1,700 students to find out what their education or information on LGBT people is, and dental is in the orange. And you can kind of see that overall we're the lowest within that description. And then also with attitudinal awareness, we feel that we're the lowest, as well as basic knowledge. So here you can kind of see, again, if you go with the orange, the annual LGBT patient, it looks like if you have 2 individuals, only one person is seeing an LGBT patient. The other one didn't see one at all. That's why it's half. And then you have only roughly 1.23 curricular hours given on LGBT people. And most of that has to do with HIV and how to deal with that, which obviously there's so much more, and which is why I haven't really mentioned a lot of HIV issues. Strategies for at-risk individuals kind of So obviously you want to avoid assuming. And so instead, if you're turning to a patient, be like, if you're dealing with a kid and say, oh, did your mom bring you in today? You might want to say like, who brought you in today? Or what guardian are you with? Or what's the name of your guardian? Also at the front desk, instead of saying she is here for her appointment, you can say the patient is here for their appointment to keep it gender neutral. And also, and I get this one all the time, instead of, oh, do you have a husband or do you have a wife? You can say, are you in a relationship or do you have a spouse? Because I get asked if I have a wife all the time. And sometimes that can be a little awkward because depending on the individual, I don't know if I necessarily want to get into that conversation. And so that's where it's just trying to stray away from heteronormative and where you always assume that everybody's straight or in straight relationships and try to keep it more gender neutral to make patients feel comfortable. Excuse me. And then, of course, we have accountability. So sometimes being the only one in your office to create change, that can be a little difficult. So it's hard to open up dialogue with coworkers. So you try to create an environment that can be more respectful for everyone to work there. But it's okay to politely correct colleagues if they're being insensitive. Sometimes what you can say is those kinds of comments can be hurtful to others that don't create a respectful or professional working environment. What you don't want to do is say you are being disrespectful or attack the person, because that's not going to help foster change. What you want to do is focus on the action that the individual is doing. So that's why this statement says those kinds of comments can be hurtful. So that way you're not saying that you yourself are bad, but more that sometimes different actions could be done in order to be less hurtful towards individuals. Because people aren't naturally bad. They just maybe say the wrong thing from time to time. And then here's some resources. So if you wanted to take a picture of it, you can, but National LGBT Health Education Center obviously does training, continuing education, helping in all those areas. LGBT Aging Project obviously deals with the resources for your older adults. Then you have the GLMA, Health Professions Advancing LGBTQ Equality. And I signed up for this, where it actually has a national health directory. There's not too many hygienists that have signed up for this, so that would be kind of cool. It's free. There's also the World Professional Association for Transgender Individuals, which focuses more on transgender health. And then the Trevor Project, which is a crisis service that helps the youth and has a 24-hour basically suicide awareness or something that they can helpline, is what I'm trying to say. So clinical signs, we are here. This was a fun drag show that was, I think, on HBO. If you haven't seen it, you should watch it because it's pretty good. But anyway, something that you kind of want to look for is you can use something as easy as disclosing solution, where if you see change in their home care, where maybe they've been healthy before, or even if they've never been and you constantly see this, you might want to look into maybe anxiety or depression for why they're not taking care of themselves. And then, of course, people who are on anxiety and depression medications are at a higher risk for developing dry mouth, because those anxiety medications focus on serotonin reuptake inhibitors. And when you mess with serotonin, that's all part of the digestive tract. Those receptors are in the digestive tract. And guess what? Saliva is connected to the digestive tract. So again, something simple that you can kind of look at as to how to help someone. Sometimes I say, something that's kind of easy when you're depressed or it's hard to take care of yourself is brushing your teeth. You can just think of it as spending 2 minutes focusing on you and helping to improve yourself. Here I had a young gal, teeth actually looked pretty good. I didn't see brushing twice a day on a depression medication, but was flossing occasionally, been a while. But when I got her x-rays back, I could see that there were a lot of cavities in between her teeth. And I'm like, okay, her gum tissues look healthy. She's doing well. Bone levels look fine. So what's going on? So something that's important that you can do is always do a saliva test. It kind of gives the pH and buffering capacity on that. So that's something you can look for. If you have a question about that, I can message you what saliva test strips I use. I usually do them for free because it takes about 7 seconds just to put it on their tongue, have them like rinse it around or whatnot, and then you pull it out and compare the acidity levels to see how they're doing. So hormones from male to female. So when they decide that they want to use hormone therapy, it obviously is going to increase their estrogen levels. What that does is acts as a muscle relaxant, kind of like if someone was pregnant. So it's going to decrease those smooth muscle tones, which also then would cause the esophageal sphincter, which is just above the stomach, to relax. And so transgender women are more at an increase for acid reflux by about 32%. Also, they're at an increase for thrombosis, which is clotting. So you want to make sure that if they're on a blood thinner, that it's because they're on estrogen therapy and not because of something, or not because they already have thick blood or high blood pressure. Because if you're doing scaling or root planing, you want to keep them on their blood thinner if they're on estrogen therapy. Now, if they weren't on estrogen therapy and they're taking the blood thinners for high blood pressure, whatever, then you could probably have them be off of it for a little bit if you're worried about bleeding out. But like Dr. Tom Viola says from Dentistry IQ, is that you can always stop the bleeding, but you can't stop a clot. So that's just something to think about. And of course, we obviously know that increased estrogen causes blood flow to the gums, like when someone's pregnant, so it can cause them to be more sensitive and irritated. So it's important that they know that to keep brushing along those areas. As far as transgender men having high testosterone can increase heart attack issues. Someone suggested that it possibly could cause more grinding or clenching. So that would be something that you wanted to look for. But as far as periodontal issues, they're not usually more susceptible. So, and then gender affirming intervention, trans women and men may not report chest hurting or fear of being taken off hormones, for fear of being taken off hormones. So if you see that they're maybe sweating or, look like they're having a heart attack, it's possible that they could be because they don't want to indicate that, that their chest hurts. Some don't have healthcare and may use non-medical grade pharmaceuticals. So if they're using silicone fillers or hormone injections or non-medical personnel, just make sure you're doing your EO-IO, check those lips, because my friend Sophia Kennedy, obviously she has a little bit of some fillers. So you just want to make sure that there's no hard nodules or anything like that. Otherwise you might be like, you might need to get that checked out. So things that you can change in the office, we'll kind of go over those real quick. So we have on the medical form, you can use inclusive language if you wanted to do something small, like what is your preferred name or preferred pronouns. We have preferred name on ours. So obviously if their legal name is Kennedy, but then their preferred name is Michael, then obviously we know that that individual, is most likely transgender, and we'll call them by their preferred name. And then if you wanted to go a step further, you can do what is your gender. You can also do what is your sex at birth. And then you can do you identify as transgender or transsexual. Now, transsexual isn't used very often anymore, but basically sometimes people will use it if they've completed surgery and completed their gender confirmation surgery, then they will say that they're transsexual rather than transgender because now their gender matches who they are. And then you can always put a patient non-discriminatory policy out in your waiting room, just saying that you will do equal care, will be provided no matter what your gender identity, religion, sexual orientation, etc. And then what does your office look like? You just want to make sure that if you have magazines that you could use some gender neutral magazines like GQ, Attitude, Out, Curve. Your posters could be maybe a little more gender neutral if you like. And then brochures, you could also have brochures out there too that help fit those individuals in the education that they need. This was something that I did an event where I just went to Pride and we offered advice, gave out toothbrushes and stuff like that, things that you can do to kind of help out your community. You can set up a booth. It's something easy, but very helpful. And then you can find your local LGBT directory. I gave 2 examples of Nebraska and Virginia, but each one has a resource directory where you could find then a dental office or sign your dental office up saying that you're LGBT friendly and would welcome them in with open arms. And then we have the Ryan White program, where, of course, they have over $13 million of dental benefits in 2021. So you can sign up to be a provider for HIV-related services. It helps fill the gaps met maybe not by some of the payers. And then you get dental reimbursements within that program. And then we have basically just saying that to be culturally humble, I hope we acquired some foundations of understanding, maybe recognized or reconciled some personal beliefs. We create and hopefully an inclusive healthcare environment and use the identifiers suggested by those patients. So again, I just want you to think that some of these things may be irritants, may hit negatively, hopefully not, but hopefully you're more the oyster and you turn that irritant into a positive and create a pearl out of it. So that's kind of pearly white prevention. I thank you. And this is my contact information if you want to get a hold of me. And I guess we're good for Q&A. Okay, so I have, or unless he's going, did you want to go? Okay. I was talking to the moderator. So I had one question up here. Oh, if there's more sex positive term rather than the dirty deed, you're absolutely right. Sex sometimes just makes me uncomfortable to talk about, but yes, it's not a dirty deed. Sex positive. Yes, you're right, Dara. Absolutely. You mentioned your voice. Is this a choice or is it due to a condition? No disrespect. No, you're very sweet. It is not a condition. I've tried for the life of me when I was trying to fit in society, try to sound more masculine, be more fit in the norm, be more cisgender. And I don't know. For some reason, I think there's a gay gene and it comes out in a lot of us and we don't try the accent. It just shows up. Let's see. So it says, how do we dental offices update medical history forms for those who are undergoing transitions? Basically, you would just want to know what their, maybe how long their hormone therapy is. If it's one of those things where we're, well, never mind. That's the hormone therapy is obviously going to be for a long time. I think that they will indicate whether they want to let you know if they've gone through kind of sexual reassignment surgery. But I don't know if that would be something that we would update on our medical history form as far as dental wise. Medical wise, good question. But I would leave it up to those individuals to fill out that information because that would be just an uncomfortable situation if you were trying to force them to let you know. And then it says, isn't society not completely on board contributing to more suicide on average? You would be correct that sometimes society is not completely on board, hence why suicide is higher within those individuals. A lot of people might think that, oh, well, maybe they, it's just their mental state, but a lot of it is discrimination and minority stressors that actually cause them to have anxiety and issues like that. And I think that's about it.